Good morning, everybody. Whoever is attending my lecture series on diabetes and anesthesia. When the normal glycolytic pathway becomes saturated, the polyol pathway converts the glucose to fructose via the sorbitol. Sorbitol may accumulate in those tissues where the enzyme responsible for catalyzing its conversion from glucose, aldose reductase, is present. As for example, the kidney, eye and arterial endothelium. This may trigger various metabolic abnormalities, including the osmotic effects of sorbitol and fructose, reduction of myoinositol, and depression of sodium-potassium ATPase activity. Insulin is necessary in the early stages of the inflammatory response, but seems to have no effect on collagen formation after the first 10 days. Healing epithelial wounds exhibit the minimal leukocyte infiltration and, unlike deep wounds, are not dependent on collagen synthesis for the integrity of the tissues. Thus, simple epithelial repair is not intended in the diabetes patient, whereas the repair of deeper wounds is impaired with respect to collagen formation and defense against bacterial growth. Infections account for 2/3 of the postoperative complications and about 20% of perioperative deaths in diabetic patients. It has been thought that diabetic patients experience more infections in clean wounds than do non-diabetics. Many alterations in the leukocyte function have been demonstrated in the hyperglycemic diabetics, including decreased chemotaxis and impaired phagocytic activity of granulocytes, as well as reduced intracellular killing of pneumococci and staphylococci. When the diabetic patients are treated aggressively and blood glucose levels are maintained below 250 mg per 100 ml, the phagocytic function of the granulocyte is impaired and intracellular killing of bacteria is restored to nearly normal levels. Now we come to perioperative approach to diabetes mellitus. Diabetes itself may not be an important to perioperative outcome, as the as its end organ effects are. The overall aims of perioperative management of diabetic patient. The major risk factors for the diabetic undergoing surgery are the end organ disorders associated with diabetes, cardiovascular dysfunction, renal insufficiency, and joint collagen tissue abnormalities, that is, limitations in neck extension, poor wound healing, inadequate granulocyte production, and neuropathies. Thus, a major focus of the anesthesiologist should be the preoperative and preparations, pre-procedure, evaluation and treatment of these diseases in the ensure optimal preoperative and preparation conditions. This comes to the end of this lecture series for today. I will come with more information in my next lecture series tomorrow. Thank you.